The next talk is our water at risk, lead in drinking water. And we have Luke Treutel to talk about this. So Luke is a lead and copper rule manager for the Division of Drinking Water at the Utah Department of Environmental Quality. He formerly worked as the DEQ in the DEQ lead-based paint program, as you saw his craft upstairs on the horse. He's responsible for enforcement of the lead and copper rule, and he's going to manage an upcoming grant project to test school and child care facility drinking water for lead. So let's welcome Luke.
Okay, hi everyone. So my talk today is going to be about lead in drinking water, or as it was titled in the agenda today, is our water at risk, which is kind of a terrifying thing to have to wonder about. But we see time and again with all these events that are happening currently and in the last 15, 20 years throughout our country, that it's something that we do need to think about. So a little bit about me. Claudia already gave my bio and my credentials, so I don't really have anything else to try to impress you with to make myself seem like an authority. But I'm originally from Wisconsin. My photo, I've got the hat with a W on it. And I did similar work there as well. And one thing that I routinely hear is people kind of disregard Utah. They say, oh, Utah's a new state. We don't really have lead problems. That's for older states, like in the Midwest and the Rust Belt and in New Jersey. But if you have homes built before 1980, likely have lead in it. So this is really true across the country and across the world, that these are some issues we need to think about. So today there's a bunch of talking points I'm going to go through. The first one I want to start out with is, why should we care about lead in drinking water? I think it's pretty obvious that lead-based paint is a serious issue. I think it should be pretty clear that lead in drinking water deserves some attention too. How does that lead get into drinking water? I'll go through some case studies. These are like my favorite things to talk about because I think we can learn a lot from these different situations, and there's been too many for us to learn from. How we manage it, and by we I mean how does the state of Utah, how does someone in my position try to keep track of this and make sure that this isn't a problem in a lot of communities. Some challenges that this issue has to deal with. What we can do, and by that I mean what the state government can do, what can the federal government do, what can physicians do, what can just parents and consumers do about this. And then some reasons for optimism. Maybe after these first 6 points, you might not feel like there's any reasons for optimism, but I think there are, which is kind of a cool thing that makes this an interesting topic to work on, that there are some wins that we can actually get, which is kind of rare in the environmental world. All right, so first...
You're fine talking that one.
Okay. First, I'll start out with some questions. And these won't be hard questions, and these are not for your continuing education credits. I think you should be able to answer these pretty well. So first of all, who here drinks water? Everyone? Okay. How about tap water? Okay. Yeah, my wife only drinks LaCroix and sparkling water, it seems like, so she doesn't drink a lot of tap water. These last few are kind of rhetorical. I don't really need to go to every one of you and get answers, but do you know where your water comes from? That's kind of a spooky thing, the way I phrase that. It's like, do you know where your children are? But do you know where your water comes from? Does it come from the ground? Does it come from reservoirs in the mountains? Does your city buy it from another city? Is it coming from a river somewhere? My experience is that most people don't think about this. The answer is it comes out of my faucet, or it comes out of my fridge. That's where the water comes from. So something to think about. And have you ever had your water tested? I will raise your hand if you've actually had the water tested in your home. Okay, I can't even raise my hand for that, and this is my job. I haven't had my water tested. But one thing that I think is really interesting about this is water is clearly so vital. We all drink it. You learned in 3rd grade science class that all living creatures need water. But while it isn't so incredibly important, we just kind of take it for granted and ignore it. It comes from the fridge, it comes from the faucet until there's a problem. All right, so why should we care about this? this is not going to be a huge mental exercise here. I think the first important thing to recognize is everyone drinks water. Sometimes there's lead in water, and lead has negative health impacts. I'm not going to go through all those health impacts. I think we all understand the developmental delays, behavior problems that this comes from. But this question, I think, doesn't really even need to be answered. I think policymakers, scientists, everyone kind of recognizes that we should care about this. And I think we're starting to. Unfortunately, it took some really terrible events like in Flint, Michigan for us to care about it. But I think it is on people's radar now, which is good because we can do something about it. All right, so we have so many different pathways that you can be exposed to lead. You might now just be terrified that it's everywhere. It's in your house, it's in the soil. But I wanted to highlight how it's different. How is it different than dust or lead-based paint chips or maybe some other routes of exposure? So how it's different is it disproportionately impacts children and pregnant mothers. You can see here we have an infant drinking formula, and perhaps that formula is made from tap water at home or at the child care facility. And I think a lot of people get really concerned about, hey, what's in my formula? But maybe they don't consider what's in the water that I'm mixing my formula with. So because of its use in formula and just how it can be transmitted through pregnant mothers to their children, it really can impact them. And just looking at the absorption efficiency, so this is how much of the lead that is in the water actually gets taken up by the body. For adults, 3 to 10%. So that's not super high, but for children, it's 40 to 50%. So they are a lot more efficient at taking up that lead. And I think that's kind of intuitive. You know, they're growing a lot. They need a lot of nutrients. Their bodies are looking for calcium. They're looking for things to help them grow. So we can see here that children are way more efficient at actually taking it up. And for children, the age 1 to 5, an increase of 1 part per billion of lead in the water leads to a 35% increase in the lead in their blood. And I think that's related to that absorption efficiency. And this is all from a paper from the American Journal of Public Health in 2016 from Dr. Mona Hanna-Attisha. It was about elevated blood lead levels in children associated with the Flint drinking water crisis. So this kind of brings me back to college, having to do my citations, but I'd be happy to share that with you. It's actually a pretty interesting read, but I didn't want to be charged with plagiarizing. So it is different. It's different, and I think Danielle made a really good point that lead-based paint and dust is the #1 contributor to lead poisoning, but I think water is important too, and I think some people have kind of brushed it off, but I think it's clear that children take it up really quick, and we're finding in more and more places. So before we can really think about how to tackle this, I think it's important to understand how did it get there in the first place. So lead is a metal, naturally occurs in the ground. Utah has a pretty rich mining history. There were lead mines in the Park City area, and lead was an awesome product for a lot of things. It was great in paint for some things, for durability, things like that. And it was a great plumbing material. And this is the main way that we get lead in our water, is from those plumbing materials. Bold and underlined, this will come back later, that lead mainly gets into our water from plumbing materials that contain lead. Again, apparently we love our Roman history, but here are the Roman aqueducts, and these are full of lead pipes. So I think in the last few years, I've heard about 250 different reasons why the Roman Empire ended. One of them was because they had lead in their drinking water. One was because they were putting lead in their wine to make it taste sweet. I don't think it was the lead pipes. They had really hard water in Rome, so they were pretty much coated with a hard water scale. But I kind of put this up there just to make us recognize that for for centuries, we've been using this in our homes, in our buildings, because it's really good as a plumbing product. It's really easy to work with. It bends really well. You can weld it, and it's just it's very easy to work with. Unfortunately, we know it's toxic. Just like all these other products, like asbestos, great insulation, but it gives you cancer. So some other things that we just should recognize is that while that lead might be in plumbing materials, the water that's running through those pipes, the chemistry of it really matters. What's the pH? How hard is the water? And if you have some corrosive water, if it has a low pH, or you have some other changes in water chemistry, that can kind of bring out that metal from the pipes, which then goes into your drinking water, goes into your glass of water, the bottle that you are mixing your formula with. So that's a theme that's going to come up over and over again, especially in the case studies, is that this water chemistry really plays a huge role in how we get exposed to lead through our water. Cool. So I'll start out with some case studies here. When I was in college, this was my favorite way to learn, through these real world examples. We'll start out with the most famous one, unfortunately. So is anyone here from Flint or worked in Flint? Okay, so Mary, Dr. Brown is familiar, and I also have the Washington, D.C. case study up here, and I'd love your thoughts on that one. But Flint, Michigan, what happened there, I'm sure you've heard about this. This is kind of a poster child. It's considered the worst environmental justice event in the last 100 years in our country. So what happened is they changed their water source, and they originally were using some lake water. I believe they were purchasing it from another city. They were purchasing it from Detroit, and Detroit was using Great Lakes water. And then an emergency manager who was assigned by the governor to go in to Flint and kind of help them fix some things up and get in shape, because they were having a lot of budget issues. They looked into changing the water source to save money. Why are we paying Detroit for all this water when we have this Flint River that runs right through our city? And there were some huge consequences from that. The river water was way more corrosive, more acidic, lower pH, and that really wasn't considered, obviously, to the extent it should have been. Because of how corrosive that new water source was, metals were released from all these old homes, and people were exposed to high levels of lead, over 100,000 people, thousands of children. And something else that's interesting that I won't spend a lot of time on is after this event, there was a spike in Legionnaire's disease, which most of you are probably familiar with, but it's this illness that has pneumonia-like symptoms, can really be dangerous for people who are immunocompromised, can lead to deaths. I think there were several deaths from Legionnaire's disease. And so they had the metals released where kids and people were being exposed to this lead, but then at the same time, the amount of their disinfectant, the chlorine in their water, was kind of being used up by this change in water chemistry. And that because of that, their water wasn't getting disinfected as well as it used to be. And so then we have all these other effects down the road. So that's just something I wanted to bring up in case there was an event in a city or in your community similar to this. I hope that never happens again. But if you see some patients who are having pneumonia-like symptoms, maybe you can remember, hey, this happened in Flint. Maybe it's not pneumonia, maybe it's this, and we should keep that in mind too. Okay, so now one that's in the news currently, Newark, New Jersey. So what happened in Newark? They had some issues with their treatment. This wasn't like a big decision to change a lot of things. I think they just were having some problems with their processes, and just things weren't working very well for them in their operations. Their water became corrosive. Hey, there's that word again. They had lots of lead in their plumbing. These houses were old, and they had a lot of people, a lot of low-income communities with lead in their homes. And the city gave out filters, which later found out weren't very effective at actually removing lead in a lot of cases, which made it worse. And then the city gave out bottled water. There was a ton of confusion about who gets the bottled water, where do they get it. Did anyone hear about the issues with the bottled water? It was expired. A lot of it was expired. So I feel really bad for those people who were confused and didn't have their water. That's such an awful situation to be in. But at the same time, I wouldn't have checked you wouldn't think to check the expiration date of the water if you're getting it from a wholesaler or something like that. But there's just so many things that go into having a good response to this, and they just had some bad luck, I think, in that case, and some lack of preparation, which was terrible. And then Washington, D.C., this one was a huge event earlier than Flint. And Dr. Brown, actually, I learned yesterday, was involved with this and was in the middle of it. So in D.C., they changed their treatment. So they were using chlorine to disinfect their water. That's a common chemical that everyone uses in most communities, just to make sure you're not going to get any bacteria or anything like that. And they changed from chlorine to chloramines. Those words sound similar because they're pretty similar chemicals. They did that because chlorine can react with some organic materials in the water and lead to what we call disinfection byproducts. I'm not going to give you a water chemistry class today. But essentially, they were concerned that the chlorine they were using was creating some byproducts that were carcinogens. So they said, let's change our treatment to something that we think is going to be safer. Spoiler alert, it didn't end up being the silver bullet they were hoping. Water became corrosive again, and metals were released. These are pretty much copy and pasted slides. And then one thing that I think was true here, and I'd love to have Dr. Brown make some comments on this, is just this phrase you've probably heard: it's not the crime, it's the cover-up. So they obviously had some issues with their treatment and their water quality, but it was made so much worse by officials and people trying to hide it from the public, and that made it way worse. You can see there were a lot of protests from citizens, like, demanding answers, and this was a really serious event that really gets overlooked. But Dr. Brown, do you have any comments you want to make about this?
For all three of these cities, and for many other cities, Jackson, Mississippi, and some other places in the country, the key here is they changed the water, right? So only in the last year or two, the American Water Works Association and the US EPA has now, first they recommended, now I think they require that if you change the water or you change the water chemistry, you have to test for lead to ensure that the corrosion control that you're using is still effective under the new conditions, right? So the water that comes up out of a deep well is not very corrosive. And you don't have to put a lot of anti-corrosion in it to make it so that it builds up the scale and the lead doesn't leach. The Flint River is an industrial river. It has been an industrial river for over 100 years. The water was so corrosive that General Motors stopped using it to wash the cars after they painted them, before they took them sent them off to be sold, because it was taking the paint off the cars. The cover-up in Washington, D.C., and as I explained to Luke last night, as a result of this, I was investigated 7 times without any finding that I ever did anything wrong. But in fact, there were a lot of people who did. So you can't, water authority, to be under compliance with the lead and copper rule, cannot have more than 10% of the samples that they do on people's homes, about 100 a year, not more than 10% can be over 15 parts per billion. So that happened in Washington, D.C. for a couple of years, and so the Water and Sewer Authority decided that if they just tested more houses, because they tested more houses, they could get under the 10%. So they didn't tell people what was going on. And then they went out and they tested thousands and thousands of homes, and it didn't work the way they hoped that it would work. They still had more than 10%, and that was very bad. A lot of people lost their jobs over it. But within 6 months of CDC coming in, me coming in, and working very carefully with the Water and Sewer Authority and with the EPA, that started in January. By June of that year, the water lead levels in DC were at historic lows. right? So, I mean, there was a response, and the response when it happened was very, very quick. There were some people that said that given the 35% number that you quoted for every 1 part per billion, well, there were some water lead levels in Washington, D.C. that were 300 parts per billion, 400 parts per billion. So some people did back of the envelope calculations and said, well, given that, we should have children who have blood lead levels of 200 micrograms per deciliter who are, being emergency admissions. I know the people that do the lead poisoning and would be doing the treatments in Washington, D.C. Had that been the case, they would have called. But they decided that I must have fudged the data. What we really saw was the trend of decreasing blood lead levels that had been happening in Washington and around the country, as I showed you today on the slide earlier today, was reversed during this situation in Washington, D.C. So blood lead levels greater than 10 no longer, they didn't go up, but they no longer continued to go down. They just stalled. And blood lead levels 5 and higher went up during the period of time. So children didn't have symptomatic lead poisoning. They weren't dying from lead poisoning. They didn't have more kids being treated for lead poisoning and hospitalized for lead poisoning. But it took a whole lot of children who had blood lead levels should have had blood lead levels of 2 and gave them blood lead levels of 8. And I don't think you need to overstate these tragedies. I think it's simply, you put those facts out there and say, this is something that should never have happened. In Flint, they were just trying to save money. And you were generous, right, in your characterization. Basically what they did was they put a spigot in the Flint River, right? And they took all this water and they ran it through. And in the beginning, they didn't put in the chlorine. They didn't put in any disinfectant. So they melted all the scale inside the water pipes. And then there were 2 outbreaks of Legionnaire's disease, one that summer and then the next summer. Something like 7 or 17 or something people died as a result of that. And then after a while, they figured out that that was from the disinfection, no disinfection. So then they decided they were going to shock the water. So they're going to put a lot of chlorine in it. So then everybody who's sensitive to chlorine broke out in a rash and their hair fell out. And then after that happened, then they figured out, then the water turned red, right? Because they melted out this mineral scale and then the iron came out. And then the children got lead poisoning. Now, there are probably several generations of people who live in Flint, Michigan who will never drink water out of the tap again as long as they live. And the ongoing crime is that many of these people are poor and they're spending their money that should be being spent on food or medicine or, God forbid, a vacation, who are spending it on water. So there's lots of different levels when you start thinking about water and how important it is. But there's not one of these that you presented that was necessary. And so, but if anybody in Utah, if you talk to your water authority and they say, oh, we're going to change, we're not going to use the deep well, we're going to start using a river, or we're not going to use chlorine, we're going to use chloramine, or whatever change, they have to do corrosion tests when they do that. Okay? That's all I got to say.
Yeah. Thank you. Yeah, it's fascinating. Great to hear someone who had to experience it, but unfortunately investigated 7 times. Glad you made it through. Okay, and then one last case study you might have heard about today, Sandy. So this was different than some of these other examples I gave, and specifically it was an equipment malfunction. So it wasn't a choice to change the water source or anything like that. It was a fluoride overfeed in Salt Lake County and Davis County. All cities and towns put fluoride in the water. And this certain pump in the station in Sandy had an overfeed of fluoride. That lowered the pH of the water because the fluoride, the substance that adds the fluoride to the water is an acid. So that lowered the pH of the water, metals were released. Rinse, repeat, you've seen these words here a lot. Metals being released after a change in water chemistry. So that's one that wasn't far from here. And like I said at the beginning, people would say to me, well, Utah's such a young state. We're not like DC and Milwaukee and all these old cities. But clearly, we have some old infrastructure here as well. Cool. So some lessons learned from these case studies. We need to consider changes in water chemistry. Like Dr. Brown said, we have some new protocols in place to consider those. So a change in water chemistry can come from a source. Maybe you're switching to and from a well. Maybe you want to use river water or a different reservoir. And also treatment. Are you starting a new treatment? Are you using new chemical? Things that need to be considered. And in order to do these things, a water system, and that would be your city or whoever provides you your water, they would get a permit from my office saying, hey, we're drilling this new well. We want to add it to our water system. Or we want to start adding chlorine, and we haven't in the past. At that point, we make them do lead and copper testing to look at the water chemistry beforehand to kind of see, hey, how much of an impact this is going to be. And once they start it up, do lead and copper sampling to say, hey, is this having an impact? Let's catch it right away, and see what we can do to change it. And then transparency is key, as you saw in DC and everywhere else. If people aren't in the loop, if citizens don't know what's going on, they're going to be scared. And that just compounds things. And that is, I think, a public health issue in itself. Just the mental health challenges of just not being able to trust the water that's coming out of your tap. It would be an awful thing to have to experience. And then also just something to keep in mind, like, where are these people getting their information? Are they getting it from their water system or the state? And are those people being honest with them? Are they getting it from Facebook? Are they getting it from their sister-in-law? And it's just, it's something I wanted you to keep in mind in case your patients come to you with some fears. Maybe they seem a little dramatic, but maybe that's a good place to start. Where did you hear this? Where did you get this information? Not that I want to minimize them or their concerns, but just kind of maybe set them straight or put them at ease if perhaps they're concerned about something maybe they don't need to be, or they're kind of getting led down the wrong path for some reason. So we all need to be aware of the issue, especially people who are tasked with protecting public health, health departments, agencies like my own. Just be aware of these changes in water chemistry, and also just the transparency piece is something we all are involved with. So how do we manage lead in water in Utah? So we have really a few things we have to keep in mind. One is be aware of potential sources of lead. So that's going to be plumbing, materials, and things like that. And then how can we control those? We can change the water chemistry to make sure those metals don't leach into the pipes. We can add chemicals, corrosion inhibitors. We can add some sort of phosphates that will help prevent that water from kind of getting metals into it. And then another option would be just to remove the sources. Danielle mentioned how that's the best route to go. If we can just remove all the lead from the environment, we don't really need to consider anything else. In the lead-based paint world, you would go in and just remove all the paint, bag it up, take it out, and then you don't have to worry about your kids chewing on the windowsill. There's no lead-based paint there. And here we have a photo from the city of Madison, Wisconsin, where I previously lived, and they're ripping out all the lead service lines in their city. That costs millions of dollars, and it's very disruptive. This is someone's front yard, and property rights and property concerns are a huge thing to have to deal with. But that's the best case, but it's very expensive. We have some other things that we can do. You could actually line the pipes with like a cement or something like that. So there's a kind of a more permanent protective layer, so the water's not actually hitting the metal, it's hitting a protective layer you put in there yourself. But those are really the two big ways: control the water chemistry or just remove the lead, and that would be ideal. From a regulatory perspective, this is kind of where my job comes in. We have some regulations, specifically the lead and copper rule. So these lead regulations I have up here now are all focused on water. We obviously have some about lead-based paint. There's some about leaded gasoline and things like that, but these are all about lead in drinking water. In 1988, the U.S. passed the Lead Contamination Control Act, and that was a ban on putting lead in plumbing products. So after 1988, there was a limit on how much lead could go into a pipe or go into a faucet that was going to go in someone's home. And again, that comment I get that, hey, well, we don't have that many old houses here, so we don't have to worry about lead in our water. 1987 wasn't that long ago, and I think we have a lot of houses that were built in 1987 or before then. So it's really not that long in the past. The lead and copper rule was passed in 1993. It's been modified a couple times, and right now the EPA is working on some long-term revisions. I think informed and motivated by these events that we've had, those case studies I went through, trying to see how can we make this more protective and have a better idea of what's going on. So I'll talk specifically about the lead and copper rule. So I know this conference is focused on lead, but from a drinking water perspective, lead and copper are kind of grouped together because they both are in plumbing products. A lot of you probably have copper pipes in your home, and changes in water chemistry affect them in a similar way, where if you have a change in your water chemistry, you might get a lead release and a copper release. So since they kind of act similarly, the rule is kind of focused on both of them together. But I'll just try to focus on the lead piece of it. So how the lead and copper rule works is the water system, your city, who you get your water from, they create a sampling site plan. This is a list of all the homes that they're going to ask to sample. The lead and copper rule is a little bit different than most of the other rules that your water system has to deal with. Typically, they just do all these things behind the scenes. They take some samples at their wells and things like that that you never even really see or have to deal with. But for lead and copper, what they're really concerned is, hey, is the water I'm delivering to your house leading to some corrosion of your pipes that could be poisoning you? So for the lead and copper rule, they send out bottles to people across the city who agreed to participate. And they say, hey, can you please take a sample at your kitchen or bathroom sink after 6 hours of the water not being used, and then we'll send it to the lab. So they distribute these, and they target them to homes that they think might have lead and copper pipes in them. So they create a sampling site plan that pretty much has all these addresses of saying, hey, these are all the homes where we think there could be lead and copper pipes, and we're going to ask them to take samples. Those homeowners collect the samples. They're sent to a lab. They get their results back, and they share those results with the homeowner. And then if they exceed the action level, so if they exceed that 15 parts per billion limit, then they have to do some things to correct it and make sure that people are being protected. So I'll start with a sampling site plan. So a sampling site plan, or SSP, is a list of sites where these samples are going to be collected. It's going to include information about the sites. Where is it? Who's the contact person here? Information about the plumbing materials. Hey, is it copper pipes that has some lead solder? Is it PVC pipes? What's going on here? Do they have a lead service line? They identify high-risk sites. So if it was built before that ban in 1988, it's more likely to have lead and copper pipes in it versus like a house that was built in 2018. It shouldn't have any lead in it, at least in the plumbing materials. And then, again, like I said before, lead service line. So this is the pipe that goes from the street to your house. In almost all communities across the country, that's actually owned by the homeowner. That's your responsibility. The water system owns what's in the street, but once it hits the curb and goes to your house, that's yours. And kind of why that is such a challenge is it's expensive to replace those. You have to dig up the yard. And the water system says, well, it's your property. You have to fix it. And the homeowners might not have the resources to do it. So that's, I think, a new emphasis for EPA, looking at these lead service lines, trying to figure out where they are and what they need to do to fix them. I'll run through this quickly. And, I don't think many of you have probably taken these lead and copper samples yourself, but they fill up a 1 liter bottle. It's a first draw sample, 6 hours of the water not being used. So usually they recommend people do this in the morning, right when they get up. And the idea here is they want to find the highest level that someone could reasonably be exposed to. So this is after the water's been sitting in the pipes. That's not typical. And after you run the water for a minute, it's going to go, concentration will be reduced. But they want to see, hey, what's the highest possible level that someone might find in their home. Use the kitchen or bathroom cold water tap. These are places where you might actually drink the water. So don't take it from the outside spigot where you have your garden hose or a seldom used tap like in your laundry room, because the water's probably sitting there a lot longer. It's going to give you a high result that might not be accurate and representative of what you're actually drinking. The homeowners are given instructions about how to do this. Another reason why the water systems don't love this is because sometimes the homeowners make errors. They take them from a bad spot. They take it from a seldom used area, or they don't fill it up all the way or something like that, and then they get a high result that the city then has to deal with that maybe could have been avoided. And then those, like I said before, send those to the lab. So I think Dr. Brown mentioned this, but what we use for the lead and copper rule is we compare the 90th percentile to the action level. So for lead, the action level is 15 parts per billion. It's there for copper, it's higher for copper. But essentially what that means is your top 10%, your highest ones, we kind of ignore those. We understand that the water system doesn't really have responsibility for all the pipes in people's homes, and they kind of give them a little bit of wiggle room, saying you might have a couple spots that are high, but if your 90th percentile, if most of them are below that level, then we think the water you're delivering is pretty good, and it's not going to be leading to a bunch of metals being leached in the water. But if that 90th percentile exceeds the action level, there's some follow-up steps that they need to do. The first one is going to be they need to give public notice to everyone. So that's not just the people who took the samples, that's everyone who's connected to that city's water. That's what that looks like. This is kind of small to read, but it essentially says, hey, this water system, this city took samples, here are the results. Here are some health effects. Give some context, because that's going to be people's first kind of question is, okay, well, the lead was high. What does that mean for me and my kids? And this is kind of the first way for them to learn about that. And I'm sure they'll probably want to look up more on their own. And then how it gets into water, and then what you can do. So this is something that was added recently, which I think is really important. Because if you just tell them all of these health effects, I think the logical question is going to be, well, what should I do? And there's some recommendations here. For example, only use cold water for drinking, cooking, and making baby formula. Hot water might contain higher levels of lead or copper. Use a water filter, things like that. And then we have some information, some contact information to the city who's saying, hey, if you have questions, contact this person, and then the resident can sign it saying they received it. So they give the public notice to everybody saying, hey, we're having some issues with lead here. Here's what the levels are. They would go to more frequent monitoring, so they have to take more samples more often. They would monitor their sources, so their wells, wherever they're getting water from, for lead and copper and these water chemistry parameters, these things that impact lead and copper. We just want to make sure that the water that they're getting, we want to try to figure out where's the issue. Is it from the source, right when it comes out of the ground, or from the river, or is it after their treatment? So that's what we try to do to figure that out, is kind of monitor some things there. And then the water system would be assigned. This is a website we have where your water system has to follow all these monitoring requirements, and this is a system where they had to monitor lead and copper and these water chemistry parameters at the location where they were actually getting water from the city next door. So they would have to kind of look at that and try to figure out why did this happen? What can we do to control it? So going back to high school chemistry class, here's the pH scale. In those case studies, the water was moving this way towards the acidic side of the pH scale, lower pH. But the water quality parameters that impact the lead and copper release, we have pH, alkalinity, some calcium, temperature, and some conductivity. pH is a big one. But those are sort of the things that were changed again and again, inadvertently or without really being considered. So if your city does have high lead levels, they could do a corrosion control study where they look at their water and say, hey, what can we add to this to make sure that lead's not being released? Or they could replace those lead service lines. And again, there's the city of Madison doing that years ago. But if the city does meet the action level and their results are good, they can go back to reduced monitoring and hopefully never have to have another exceedance. So if the city just keeps on getting good results, they just stay on their schedule, and they just have to share those results with the homeowners who took the samples, not with everybody. If you ask your city, hey, what was our lead level last year, they can get you that information. It would be on their consumer confidence report, which is a report that water systems have to do every year, that kind of gives you a summary of, hey, what was in the water, what did we test for, what did we find, what exceedances did we have. So that's a good thing to look at that a lot of people don't know about. It's called a Consumer Confidence Report, CCR, kind of like the band from the 70s. But yeah, I would look up that. I look at that now for my water system. Okay, so here's just another form that if you are the homeowner who takes the samples, you kind of get your results in this form that says, hey, this sample at your home was this. here's some information about lead. And then the city has to let us know that they gave the results to people. That's kind of a new focus. That's been in the rule, but we kind of have a new emphasis on it because we want to make sure that people are being given information. Another thing that we as a department do is we have some voluntary testing programs. We had one in 2018 where most public schools took at least one sample, one or two, sometimes more, at the public schools across the state. And then the state of Utah was just granted $434,000 from EPA to test school and child care facilities for lead in their drinking water. So when I get back to the office, I have to fill out a very complicated grant form to officially get the money. But that will be starting up in the next couple months, where we will be asking these schools and child care facilities to participate. It's voluntary. They don't have to do it. I'm not exactly sure how many will want to do it, but hopefully a lot. And they'll be seeing what's the level of lead in their drinking water through these schools. A lot of these schools are old. School budgets can be tight, so replacing pipes can be kind of lower on the list when you have teachers to pay and all these other security concerns that maybe plumbing isn't at the top of the list. But I want to put that on your radar in case, a patient or a parent says, hey, my school is being tested for lead. They found this. That's kind of a state-led initiative. It's voluntary, and we'll have all those results on our state website, and the school will have those results as well. And we'll try to help them fix any problems that they find. So some challenges with lead, there's so many sources, different plumbing products, the aging infrastructure across the country isn't really being given the attention it deserves. We have limited testing, so not every home in every city is tested. So just because the results in your city come back okay doesn't mean your house is okay. There's also limited money because it's really expensive to remediate, just like in lead-based paint. To remove all that paint or to rip out all these pipes is really expensive. And then again, misinformation. People are rightfully scared of lead poisoning, but I think very quickly there can be panic, and perhaps that's not warranted in every case. So what we can do, there's so many different stakeholders, federal government, state government like myself, your local city water system, physicians, and then just consumers and parents. The federal government passed legislation, rules focused on public health. They have the lead and copper rule. They're updating it now. Step in to help states and tribes who need technical assistance. Just be a reliable source of information. A lot of people will go to the EPA website first. And fortunately, they're seen as a reliable place to get information about this type of thing. And then just provide funding to implement the rules like they are with this grant project, and also just help communities fix the problems. State government, so this is my department here, we're tasked with enforcing the rules that the federal government passes. We just need to make sure that we're talking between different agencies, step in and help counties or cities or towns who are having problems or have questions. Again, be a source of information, and then provide funding when we can. Just the water system itself, so the person who's delivering your water, just make sure they're following the lead and copper rule, and provide public notice. If there's an issue, let people know. Don't try to hide it or cover it up. Obviously, public health should be the number one concern, but people in certain positions might have political concerns, or they're worried about how it will look. They don't want to scare people, but the truth is more important than public relations. And then again, being a reliable source of information. If your water is coming out a weird color or a weird taste, people usually call the city and say, hey, my water smells weird or it tastes weird, what's going on? And just being able to answer that and take those questions seriously. And then just try to figure out where the lead is. So that's an inventory assessment. Try to figure out, hey, where do we have lead? What should we do to plan to remove it in the future? Physicians, here you are. I originally had Doogie Howser on there, but I thought this was a little more flattering to put Clooney. So we stuck with that to keep your attention. Encourage testing. That would just be for blood lead. Know the health effects and symptoms of lead poisoning, because if we have an event or someone gets a high result for lead, any other illness or symptom they might have, they, I think reasonably might assume that that's related to their water. I had someone call the other day, and they were really concerned because they thought there was lead in their home, and they had all these foodborne illness symptoms, different symptoms than you would see for lead poisoning. But I think since water is so vital, it makes sense to me that you might just attribute everything to that. And then again, just be a reliable source of information. Know these different exposure pathways. So if you have a patient who has high blood lead level and EBL, just kind of understand, hey, paint's an exposure pathway, so is water. What community do you live in? How old's your house? Have you had the water tested at your house? Who should you call? And I'll go through that in a minute, who they can call. And then just consumers and parents, get your family and get your water tested. If you see something, say something. So if your water tastes weird or smells bad, or you think something's wrong, or you start feeling sick, call your city. Tell other people. Tell your physician. And then also be a critical reader, tweeter, Facebook share, Instagrammer, Redditor, whatever it may be. And just, if you see some sensationalized story about water, figure out, hey, what's a reliable source? Where should I go to? And is this a real concern that I need to follow up with and figure out what's going on here? Or is this some sort of website or blog that just gets clicks by scaring people? And unfortunately, that's something that we have to deal with. And what consumers can do, a question that I hope you have now is, what should I do if I'm concerned about lead in my drinking water? No one has their water tested. So get your water tested if you're concerned. This will come back again later. It's a pretty simple idea. If you're concerned, if your patients are concerned, just have your water tested. You can call the city. Oftentimes they'll do it for free, or you can call a laboratory. Like I said, water system, laboratory, local health department, they can provide technical assistance. They can call me. But usually the first stop is going to be the person who gives you your water. They'll usually test it for free. Or they'll come and test it for you and you just pay a nominal fee. So some reasons for optimism. I know that it might not seem like there are any, because right now, whenever you hear about environmental problems or drinking water, it kind of feels like just the world is on fire, and you just have to ignore it and go about your day and tell yourself that this is going to be fine and be in denial. But I think there is some reason to be optimistic. People are actually aware of this. Unfortunately, it took some terrible events for people to really care about it, but here we are, so let's do something about it while we have people's attention. The rules are being updated. Like I said, a lead and copper rule revision's coming out soon. There's more funding, like for that grant program to test lead in schools and childcare facilities. That's promising. And we can actually win on an environmental issue because we put the lead there. We put it in the pipes. We put it in the paint. We can take it out. It seems like in most environmental issues, the best thing you can do is stop the bleeding and hope it doesn't get worse. But we could theoretically actually take care of this and remove it and never have it be a problem again. So some key takeaways here. Lead primarily gets into water through plumbing materials. This is key. We have some rules to manage lead in water. If you or your patients are concerned, get your water tested. A lot of people involved that have a role, and there are some reasons for optimism. So I'll go through some questions now for the CEUs before I take questions from all of you. So hope you're not too tired, because these are going to be incredibly tough. So question number one. What is the primary source of lead in drinking water in Utah? Multiple choice. Is it gasoline spills? Is it from paint? Is it from plumbing materials or pipes that contain lead? Or is it from dust? C. That is correct.
Number 7 on your sheet.
Oh yeah, not question 1. Question number 1 for me, question number 7 for you. So it's C. Lead gets into drinking water through plumbing materials or pipes that have lead in them. It's a metal that was used in plumbing products for a long time. Okay. Question number 2 for me, which one would this be? Number 8. Okay, so if you're concerned that your drinking water may be contaminated with lead, so maybe your patient or someone else, what should you do? Should you boil your water before drinking? Should you go to your nearest lake or river and drink that water instead? Should you sell your house and just move to a different town? Or should you have your water tested? Any answers? I had a lot of fun coming up with these. I think I heard it. It's D, yeah. So actually, when you have other issues with your water, sometimes it's recommended that you boil your water if you have like a bacteria problem. That's actually would be a terrible thing to do if you have lead. It would concentrate the metal in the water. It would kind of evaporate a lot of the water. So do not boil your water if there's a lead problem. Just get your water tested. I wouldn't recommend going to your nearest lake or river and drink it. But you don't have to sell your house either. So just get it tested, simple enough. Okay, so any questions about lead in drinking water? Here's my contact information. I brought about 50 business cards. All right, thank you.